Hello, good evening. How are you? How you day? Welcome to another session of Ask the Doctors. Happy Sunday. Happy new month. The time is 8:01 p.m. here, and you're welcome. My name is Dr. Frederick Hi, I'm a licensed medical doctor. I make health videos simple like ABC so that you understand. And on this program, we answer questions, we teach. But on today's program, we have decided that we will take questions, questions and answer. So if you have any questions for me and my co-hosts, if you have a question for us today, you can drop your question and I will respond to you. Is that okay? But before we start, I need you to tell me where are you watching me from? Oh yeah, tell me. Forget my light. Light no day. Light no day. Do you understand? But we I believe you can hear me, Abby. Okay. So where you dey watch me from? Tell me. And then if you get any questions, drop in the comment section. And if you're watching this video after we have ended, I'm sorry, I might not be able to respond to you. Is that okay? Uh-huh. But I noticed that when I did live, some people would dey drop questions. But after I don't end the live session, at that time they would dey ask. Somebody says first to what? First to comment. Student reporter. So student reporter. Now you be the first person to comment. Oh yeah, tell me where you dey watch me from, student reporter. Tell me. Might give you special shout out. Are you sure you are the first? Yeah, I think you might actually be the first. Yes, you are. This is who Mr. Sonong watching from Kano. Okay, we are sharply. Mr. Abbas Alabi from Lagos. Mr. Abbas, Bawoni. Balogun Olayemi. What's that? Nepa. Haha. Nepa, I beg, help our life. Mr. Francis from Abuja. I greet you, Francis Victor. David. I greet you from Aba. Na Ajele from Ghana. How is Ghana? Metis Noah from Douala. Don't worry, I go travel one day. Comfort Atman from Lagos. Hello, Madam Comfort. How are you? Cassie Shaw. Hello, Cassie. Cassie, which Cassie be this? Huh. From Oyo State. Oya now. I salute you specially. Ask me your questions now before here go follow. Precious from Port Harcourt, PH. Mabel, I see you. I dey see your comments, Mabel, how far? Ogechukwu Okafor. Yeah, I greet you from Onitsha. From Paris. I have been having this pain. Francis says I have been having this pain on my testicles and back pain, constant headache. Mr. Guy, Mr. Waiting be your name, Mr. Francis. If you love yourself, quickly, see that thing wey you tell me so, this your testicle, so guy, go see doctor sharply. No be normal stuff. This one is not normal. So let them check you quickly and find out if everything is okay with your testicle. Back pain, constant headache might be your age, might be job, might be stress. It might be from the testicle as well. But the only way we fit tell you true wetin dey go on na when we check. So this one, Mrs. Okay, watching from Benin. Mrs. Okay, how far now? Yeah, everybody share the live session. Beauty Nana from Lagos. Beauty, how are you? Hello, God bless you. Tina Nathaniel, God bless you. Endurance from Imo State. Endurance, Kelvin, I see you. Emmanuel from Warri. Blessing, blessing. Watching from where? Ishaya from Jos. Moya o from Benue State. I still dey wait for my shout out. Oh yeah, I don't give you your shout out. Student reporter. Wetin you dey report sef? Student reporter. What are you reporting? But shout out to you. Now you be the first person to comment today. So a special shout out to student reporter. What are you reporting? Tell me. Don't worry. I'll give you a shout. I go say they give you shout out. Don't worry. Big fan here from Lagos. Justice, I salute you specially. Mike Ihenacho. Mr. Mike, I greet you specially from Owerri. Bishop Aria Toy from Worry. Come, you don't do now. Una comment plenty. You ask me your question. I dey enjoy your teachings all the time. God bless you. David Chimdi, thank you. From Taraba State, James from Taraba. From Liberia, Kaifala. I'm here to ask plenty things. Go ahead. If I know the answer. Now listen, I beg, listen. If I know the answer, for you. If I don't know, I will tell you, say, I don't know. Dr. Israel is in the house. Thank God he's here. Respect, good life in a sense, not better life. Dr. Israel, are you ready? Give me thumbs up. I read your blessing. Happy first Sunday of the month. Yeah, happy Sunday. Happy first Sunday of the month of July. Happy new month. Yeah, Dr. Israel is in the house. Dr. Israel, have fun now.
Dale, good evening. Happy Sunday
Yeah,
and happy new month to everybody.
yeah, happy new month to you. Welcome. God's will, Udo from Akwa Ibom. God's will, I greet you. Watching from Gabon. Okay, we have a question here. Thank God. What could be the cause of stomach obstruction and how best to prevent and treat it? So let me allow Dr. Israel respond to you. Everybody share. Everybody share. If you know share, problem go deal. Me and you go fight. Oh yeah, share. Dr. Israel, over to you.
Stomach obstruction, many things fit cause stomach obstruction. So many things fit make that happen. Now, but for children, the most commonest one for children is what we dey call into subsection, where one part of the intestine go food enter the other part of the intestine, and that are the most commonest cause of intestinal obstruction for children. Now, also while for adult, you can get impacted ascaris worm, when worm will come gather. The feces, impaction of the feces can also cause it. And when the person, stool don too strong, you come, e no go fit pass through. So that fit still cause obstruction. Sometimes the the function of the intestine fit get small problem, say dem no go fit dey move again. So their movement wey we dey call peristaltic movement, that thing no go dey work well again. And so that as at that point mean say the intestine don weak. So and that can actually still cause intestinal obstruction. So and also for those wey do surgery, another for those wey do surgery when no follow the instruction wey dem give am, when be say the intestine never really wake up, dem go dey take whatever dem no suppose take, e fit still cause intestinal obstruction. Dr. Fred.
Yeah, thank you, Dr. Israel. Ma add to that. Another thing again, if we cause intestinal obstruction, na mass. They call mass. Something just big inside. If you make the person get obstruction. Let's leave it as obstruction. But one thing where you ask for here now, how to prevent. Listen carefully. If you get obstruction, you have to know waiting cause your own obstruction. If your obstruction now waiting operation fit do. Now only operation. If your obstruction now from diet, your poop will dey very hard. Maybe you fit take more fluid, but Honestly, you can't manage obstruction at home, especially if true you get intestinal obstruction. No be something wey dey joke with. Na something wey you need to see doctor and they go do test for you. Okay. Let's see. Ask your questions, but listen carefully. If you ask us, make we prescribe medicine, like doctor, I get this problem. Which medicine can I drink? We no go read that question. We no go read them. So go to hospital if you are looking for medicine to treat you. Do you understand? So that make we know they repeat ourselves. Um, what was that? Yeah. Good evening, sir. Please, what is the cause of frequent thigh pain? I feel it inside my thigh regularly. Whenever I take drugs, it will go and come back later. Dr. Israel, over to you, sir.
Okay, when person they get type pain, it can be the muscles, na dey pain am. It can be the it can also be the bones, the bone in that place na dey pain the person. So sometimes it can be the depend on the kind of work when you dey do. And if you be person wey still dey waka for a long distance, all those can also cause it. If you dey sit down for one place for a very long time, that can be a contributing factor. And also if you get waist pain, those pain fit dey waka come dey enter your thigh, still dey make you dey get thigh pain. Sometimes some chemicals for the body fit dey short, and you come dey cause muscle cramp, mostly for the thigh or the calf muscle, fit dey cause all those ones. And those can just be the some of the cause. Another thing na be say you get trauma to those your leg, and maybe accident or somebody blow you for there, or they injure am long time ago when be say they do some kind of treatment for you for the bones. So those place fit come back and pain you for some time, that when you take medication they'll go. However, they always advise say if you get such things, maybe they get a lot of pain like that. When you go hospital, they will find that, try to maybe they'll do X-ray for you, do some kind of investigation for you to be sure which part, whether na the muscle, whether that is the soft tissues, or the muscle, the soft tissues, or na the bone na get problem. And also, if it be say this pain when you dey complain na something when you go fit manage without even taking any medication, try and manage am. No be everything that they take medication or swallow drug and put. Dr. Fred.
Yeah, thank you, Dr. Israel. Mabel Gilbert, abeg, ask your questions. I see say you share the live session. Mabel, you share the live session. Oluwatosin, Ayo Johnson, Emmanuel Joseph. You will share, ask questions. I go ignore other people first and respond to you because I don't beg make we share, but people know they like share. They want maybe open cloth lie down for ground, beg them before they go support us. So Mabel Gilbert, I'm looking for your questions. Make I feel respond to you. First, I define your questions through my other device because our people know they like share. Okay, I can't see. Let me check. See who be this. Okay, S6 here. We don't share. The rest people will not over to you.
Okay, I don't know whether you can hear me, and because it's, whether my network not bad on Dr. Fred network, please, if you can hear me, just put on the comment section that you can hear me, so that we will continue until Dr. Fred come back.
Okay.
Because I cannot tell. Okay, Dr. Fred, are you back?
Yes, I'm back. I'm back. Okay, please respond.
Okay.
Somebody asked whether cold water they kill. Please respond then quickly.
When I cool water, they do what?
Whether cold water they kill a man.
No. Ah. If cold water they kill, they no go. The statement, water is best served chilled, won't be there. Eh? So cold water not the key. Cold water not the key. Um, the only thing I will say, if you as a person, if you get any problem with cold water, maybe when you drink cold water and you get issue, we advise say make you stop to dey take cold water, not take am again. Some people dey, if they take cold water, they'll start to dey cough. They cough very well. So when they take cold water, they'll start to dey sneeze and so many other things. If you are that kind of person, or you take cold water, you start to have stomach pain, you know yourself, you can actually stop taking cold water. But for those people when we say they take cold water, nothing they do you. I beg, enjoy your cold water. Then so it's for you to know say cold water not the key. But if you get issue with it, you stop am. Not afraid.
Okay. Yeah, let's take her question. I don't see Mabel question. I'm in my 40s, and recently I begin to notice this sharp pain at my waist and legs. What can you say about that? Dr. Israel will talk something about
Okay, you guys, you're 40 plus. Thank you for sharing, first of all. Thank you for sharing. You're 40 plus and you dey feel pain, your waist and leg. Which part of the leg? Most of the time, let me assume it's your knee. Because once you don't reach that 40 plus and all that, most of the time, women, they get knee pain. And some of them waist pain. Just like that. This now because um they don't also dey near their menopause, or some of them they don't even enter their menopause as at 40 plus and all that. Eh? So as they dey near their menopause, they reach their menopause, sometimes, most times, some of the chemical wey dey their body go don still dey go. So those chemicals actually join wetin dey help the bone. So because dem dey go, the bone no go come get a lot of those chemicals again. So for that, some of them go come dey get those kind of pain. And two, if you be kind of person wey don dey do a lot of active work, wey go lead say your leg go come dey pain you or something come dey do you as at when you were young. As you grow old, there's everything there to say you fit come dey get all this kind of pain as well. Now,
them.
this pain wey you dey talk say e dey your waist, na im dey move to your leg. If na im dey move to your leg, another question na, um if you don born, did you give birth through CS? If you give birth through CS, now injection they give you for your back or you sleep. Sometimes if they give you injection for your back, if it cause if it cause pain, waist pain later in future, and if it the pain fit dey radiate to your leg. Yeah. So this one na for mainly for ladies. And the kind of work when you dey do, I not know whether I don't talk that one. The kind of work when you dey do, if the kind of work they make you dey sit down well all the time, or stand all the time, or bend yourself all the time, if it can they make you they get all this kind of pain as you grow old. That's why sometimes we advise that even for women, mostly for those when before their menopause, we dey advise say try dey do small small exercise wey go make your body dey fit and make your bones dey a bit stronger, even to the extent say when those chemicals don comot, your bone go fit still hold the muscles and every other things every other weight when when your body put on top the bone. So I hope I'm able to answer your question, Mabel.
Mabel. Yeah. Okay, thank you, Mabel, for that, and thank you for sharing. So this comment says, Doctor, thanks for your teaching. I went to run all the tests you said we should always run, and my cholesterol was very high without knowing before. Mr. Osato Joseph. And thank God say you don't check. And I believe that they help you. Good one. Well done. What causes erectile dysfunction? So wetin dey make a man get problem with him erection? There are many things. But wetin be erectile dysfunction? What do you even know? Because you might not have a problem. Erectile dysfunction means say you as a man, you no fit carry your blockers, your I don't want mention because of this social media stuff. You no fit carry and stand, or when e stand, e dey fall quick quick. Be as you dey wan use am, e go just fall. So e cannot achieve erection or you cannot maintain erection. Many things dey cause am. One, as you don dey old as a man, and when man don dey old, you understand, 50s, 60s, gradually the man fit dey lose in erection age. Two, so many things for man to get erection, he need male hormone, testosterone. He need him heart to function well. He need him blood vessel to function well. You understand? So some medical conditions fit dey for the man body wey dey affect am, wey go make am no fit keep him genital to stand and use am work. And if you no know wetin dey cause am, you no fit correct am. If you don go for checkup, you are a young man, we go always tell you your lifestyle, wetin you dey chop, exercise, these things go help you keep your erection as a young man. If you be elderly man, you never go check up at all, you go need to go make dem find out wetin dey cause am. And then on this matter, e no go good for you to go dey buy medicine dey drink, because those medicine fit kill you unless you don see doctor. Doctor come tell you say make you go drink am, because some young men get this problem. Dem no know wetin dey cause am. Dem dey go buy all those medicines wey go make dem get erection. Small small, one dem dey kill themselves. One day the man fit go kpai on top woman. So there are many reasons, and you need to know wetin dey cause your own, before we go fit come help you manage am. What can cause someone to become unconscious, and at the same time the person will start feeling press in the heart? The heartbeat will rise to 250. Dr. Israel, you want comment on this?
Person is unconscious and the same time what?
Unconscious,
If the person is
and the same time feeling press in the heart.
how will somebody be unconscious and how does he know that he's feeling pressed in the heart?
You can't be
Hmm?
unconscious and still
You
be
cannot be
knowing.
unconscious and be feeling something. You cannot be feeling something when you are unconscious. So please, I don't know if this person. The first thing is that do you even what the word unconscious,
Hmm.
what it stands for? So unconscious means say this person in lose consciousness.
You
That
don't
is,
know
he
what
not know
happened.
where he dey again.
Yeah.
He not know what dey happen again. In fact, when you dey sleep, some people dey sleep, they enter the state of unconsciousness. Like when you dey sleep, people come pass you, do everything, you no hear. That's unconsciousness. So for sickness, so this person not get, he not know wetin dey happen around am, na be unconsciousness. So he not go fit feel say he heart dey press am or whatever dey press am, or your heartbeat dey 100 or 200 and something. If your heartbeat even dey 200 and something and you no dey hospital, na be say okay, I no know, may I not talk anything pass there. So please, if you have anybody like that, or if you have anybody like that, that person should be in the hospital, should be seeing a doctor, and the doctor know what and what to do. Please, they should see a specialist, actually.
Yeah. That this and see what you describe. Unless on there's see that 250 alone is an that 257 the person go don't go. So I don't know what you mean by heartbeat is 250. Here you get, is it heartbeat? Is it blood pressure? What are you talking about? But your comment get us at the end. So clarify. Maybe we see what I will respond again. And they share the live session. People are not sharing. Okay. You where they ask me for treatment for hepatitis B, go to the hospital. We no go read your comment again, huh? Go to the hospital. Okay. Um Okay, let's see. I dey check question. Your question get as e be. Uh, okay. Oh God. Oh. Okay, I have been having throat, ear, and head pain since last year. I went to see the ENT specialist. He said it could be reflux. I was given this advanced, okay, neocor, motilium, and nixium. Doc said if I complain again, I will do endoscopy. I'm currently having ear and head pain more often. Okay, Dr. Israel,
Ear and
head
okay,
pain.
head pain and ear. Okay, having throat, ear and head pain. Now the head and the ear can go together. Then the throat is yeah, the throat. Okay, so doctor said if you complain again, I will do endoscopy. I'm currently having ear and head pain more often. um I will advise that you go and see your doctor again. If possible, you can want to change another doctor. You can want to see another doctor, another ENT. But it will be nice that you go and see your doctor again. If you still dey get the ear and head pain. Now, the ear and the head can actually go to work together because the ear dey the head. So anything wey dey affect the ear can actually affect the head. They need to look at the ear very well if there's any otitis media or internal or whatever that's
Mm,
causing the problem and that's causing the problem. And that may not even be related to your throat pain.
mm-hmm.
That may not, I not say it may not be related to your throat pain. So because the endoscopy is mainly for the throat, it not go concerning, it no concern the ear and the head. So the doctor may also have other investigation that he may likely tell you to do for the ear and the head. That's why I said it would be nice if you go back and see your doctor, or if you think you want to see another doctor, you are free to check for second opinion.
Okay, before we continue, it's almost 30 minutes, so let me talk again about my course. This is my own property. A lot of people they follow me, a lot of creators they follow me. You go like my video, the video you love it, but out of ignorance, you go do some kind things with the video. We will scatter your page. I'm sorry, I'm very sorry that your page they suffer because of ignorance, and I don't want you to suffer. So if you're a content creator, you're a businessman, businesswoman, and you are on social media, you also want to grow your page, and you never learn anything, the best advice I will give to you is stop posting on that your page until you go and learn. If not, you might lose the page, especially for those who don't know anything about social media content creation. This is not to beg you, is not to look for your money. You can decide to learn somewhere else. But if you want to learn content creation, you can get my course. It will help you. I'm not here to beg. But if you know, say you don't know, you go do mistake, maybe with any of my content, my videos, it spoil your page. It's not nice. You go get depression, it go pain you. And I don't want that to happen to you. So get my course, send an email. My admin will give you the details, account to pay. You learn, I beg. Go and learn. And it's very cheap. Sure you get. Go and learn, I beg, so that you don't suffer on the internet. I beg, wetin person go do when she get hormonal dysfunction? Wetin person go do, Mr. Ben Frank? If a woman get hormonal problem, wetin she go do na to see her doctor. Because hormonal dysfunction or hormonal imbalance, there are so many types of hormonal imbalance. So many. Hormonal imbalance can even happen to men. Not be only woman dey get hormonal imbalance. It can even happen to babies, kids, children. But if you have hormonal imbalance as a woman, you should not be sitting on the internet and be looking for what to drink, because you would mismanage yourself. We need to find out which hormone get problem. Wetin dey cause the hormonal imbalance? Is it age? Is it medication? Is it thyroid? Is it ovarian? Shey you get many things wey we come find out, come say, oh madam, do this and do this. But you cannot manage hormonal imbalance. You need to see an endocrinologist, wey go check you, come tell you say do this and do that. And sometimes you go need to get patience too. No be say you go start now 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 And then you could expect him immediately make the thing change. You could give am time because these hormones they dey also take time to adjust themselves. Some women, some young girls, na dem cause their problem when they were young. They go there take postinor, they drink family planning, all those medicines on their own without expert advice. So there are many reasons why a woman can have this and why she needs to speak with her doctor so that they go fit check her, advise her, and tell her what to do. Some women na pregnancy related, some women na breast, some women na weight loss, some women na heat, na palpitation. So many things dey to check. Do you understand? What causes hepatitis B? The video is on the page. Gold. We spoke about hepatitis B last week. I spoke about it. I have a video on hepatitis B. Go and watch the video. Everything you want about hepatitis B is there. Okay. Let's see. Let's see. What is the cause of hypoglycemia and low blood pressure? And I want you to do a video as regard it. So before this, before I allow Dr. Israel answer, I don't already do video about hypoglycemia. Wait, David. Oh, David, is that you? This is my guy. Sorry, Dr. Israel. David, this is my guy. David, how are you now? Long time. I greet you. I just see the name. How is mom and dad? So I have made videos already on hypoglycemia and low blood pressure. Is on the page. But let me allow Dr. Israel respond to you. Dr. Israel.
I don't think there's need to respond. I think with the video you'll be able to get more explanation. So you should just look for the video. As far there's a video for it, and you will get everything that you need to know about hypoglycemia and then low blood
Pressure.
pressure, because there are two different video it be.
Yeah, two different
I can
video.
remember.
Yeah, so we have a question here. Does gastritis cause anxiety? Dr. Israel, I beg respond.
Okay, okay. The main thing is, does anxiety cause gastritis? Eh? So yes, anxiety can cause gastritis. Also some, and even the gastritis, yes, can actually cause anxiety. Like you are afraid that this thing, something is going to happen to you. You are very anxious of it, and so
Mm-hmm.
it can actually. It's not like it's a cause. Not like it's the really cause of that stuff. It's just that the thing is already there. You are just being afraid, and because of your mind is the one telling you this one is there, this one is there, this one is there, you start feeling it. eh? You start feeling it. Most of the time it's just the mindset, in terms of anxiety, the mindset. And you should know that sometimes, um to be anxious is a normal thing. Yeah, to be anxious is a normal mental health stuff. The problem is when this anxiety is not affecting your normal activity. That's when it
Mm,
becomes a disorder.
mm.
That's when it becomes a disorder. And that is when it can actually lead to any other thing. Now, it's not a direct cause of gastritis, but indirectly, because it will make you not to do a lot of things, or it can make you do a
Mm.
lot of things, you cannot
That you're not supposed
come down with gastritis. eh?
to.
And another thing is that, uh, the gastritis, because some persons have gastritis, they cannot be so anxious because they don't even know what will come out, what if it happen from the gastritis. So
Mm.
if that anxiousness can lead to wetin dey disturb their normal activities, it becomes a problem. But if it do not disturb your normal activities, sorry, it's actually just a normal anxiety, because as I said, anxiety is something normal.
Doctor, I have
Okay, Dr. Fred.
miscarriage. I have miscarriage twice, and I went to the hospital. So they couldn't. So they couldn't detect it. Is that what you're saying?
Detect.
What they couldn't detect it? What causes the miscarriage? Please, what can cause it? Okay, may Dr. Israel respond, I beg.
Okay, the thing is that, most of the time it depends on when you had miscarriage. And miscarriage can occur in the first trimester, it can occur in the second trimester. Eh? Most
Mm-hmm.
of the miscarriage that occurs in the first trimester is hormonal. And when we say hormonal, it means that it's the body that decide to remove it, because they find out that what is growing is not growing very well, or is not following the normal procedure of growing. So they don't want you to now give birth to somebody that will have only nose, no eye, and no mouth, and because the development is not developing very well. And most of the time, those miscarriage actually occur within the between 9 to 11 weeks, and that's the height of miscarriage in first trimester. Once you're able to pass that period, most of the time that miscarriage will not occur again. So first trimester sometimes chromosome hormonal issues can actually cause uh, first trimester miscarriage. Sometimes if people get stress can also cause it. The kind of work wey you dey do, you dey stress yourself very well, e fit still lead to am. Another one na you get malaria and you no treat am. You get malaria and you no treat am. So malaria can actually cause um miscarriage. So in the second trimester, another thing wey go come fit cause miscarriage for second trimester na when the cervix no get that power to take hold pikin for inside. We call am cervical incontinence. So the cervix no get the strength to take stay. Cervical incompe ten t, sorry. Cervical
Yeah,
incompe
correct.
ten t.
Yeah,
So
yeah.
cervical incompe ten t, sorry. The cervix no get the power to take hold the pikin. So if that one happen, the cervix go open before time. So that is why sometimes when you go hospital, they will do something, they go help you tie the womb. When you don already get belle, they will tie the wombs, cervical circlage. They will tie the womb so that make the pikin not, make the pregnancy for not comot. Yeah. So uh infections can also cause miscarriage, and some kind of infections can actually cause miscarriage. Then if some people get fibroid for where the pikin suppose stay, um fibroid con go grow for there, e fit also cause miscarriage. Mean say the pikin that pregnancy no go see where stay again. Another thing wey people no dey too look into wey fit still cause miscarriage, na wetin be your blood group. If you get rhesus negative and you have done, maybe you have had miscarriage before in the past, or whether spontaneous or assisted you understand the assisted one, the one wey
Mm,
some person do by theirself,
mm,
or the one wey by itself comot, no be you say you wan comot am,
mm.
and you are rhesus negative, and you no go take that injection wey go fit prevent you from having make you fit get belle again safely. If you dey that category, you fit still dey get miscarriage all the time, and you go dey think say na something else. And sometimes I notice dat sometimes most doctor fit no even remember to ask you this aspect when I talk. Most persons fit no quick remember. So, and also if maybe you dey in an abusive relationship wey be say dem dey pound you fit still get miscarriage. So I think these are so many things that can cause it. I don't know which of them would have caused your own. That's why you need to still go to the hospital. They need to check you very well, check your hormonal status, check everything depending on when you dey get the miscarriage. Dr. Fred.
Yeah, thank you, Dr. Israel. Time they run fast. So for the person we get miscarriage, wait so you don't get up to two, you go need to see a gynecologist. Look for a gynecologist if you never see a gynecologist. So that I go fit dey manage you, go follow up with you, go know how to advise you. See a gyne, no go say you go lab, go dey test, because sometimes some ladies go carry their body to the lab, make dem test them, not knowing that the lab is not where you should be. You should be seeing a gynecologist first, so that people could know many, many things. So if you never do that one, I beg, you have to do that one right away so that they go fit manage you properly, and then you go surely carry your pikin. What is the cause of constant sneezing? Constant sneezing could be due to many things. Allergy. Maybe now where you dey allergy environment, you just dey sneeze, dey sneeze. Sneezing is a way of your body telling you that I don't want this thing that is entering inside your airway. I don't want it. I want to remove it. So if the things wey dey around dey always enter and your body no like am, you go dey sneeze continuously. So it might just be that, or it might be also the weather. We dey I don't know where you dey, but also the weather has changed, and for some people, when the weather is quite cold, they fit dey sneeze. Also, e fit be your gene. E get some people, their parents dey sneeze, sneeze, sneeze. They get this hyperreactive airway. So it might just be that. Shey you get. So the first advice is try to avoid all those things if now that one dey cause am. I don't know too wetin your own case might be. And then maybe your immune system just go down. Your immune system too is quite weak and your body is struggling. So you can support your immune system, rest, take fruits, take water, avoid those things that can make you sneeze. And if your weather is cold, protect yourself from the cold weather. Dr. Israel, want to add anything?
No.
Okay. I dey try go through the questions. Uh, please, Doc, you haven't answered my question since I started following you on this. Which question? We not see your question. We not see your question. I can't see your question. That's the issue. Questions plenty. Um, what is the solution for someone that cannot even do 1 minute on bed with his wife? Dr. Israel, want to comment?
Okay, the first thing about that person is, first of all, increase your foreplay. Two, remove your mind that you cannot do 1 minute. Because the more you put your mind that you cannot do 1 minute, you continue to not be able to do 1 minute. And
Hmm.
because some people, once they just enter bed, their mind already, they say, "Mm." So the body will always react to that. Say,
Hmm.
now wetin you talk, so na so e
Hmm.
go be. So remove your mind. So the mindset is very important. Then a lot of foreplay, so that even though na 1 minute safe or 1.5 minutes, eh, your wife go already enjoy everything, that to the extent say you no go even know say na 1 minute. You dey get am. Then three, exercise is very important. Do a lot of exercise. There's this Kegel exercise you can do. Do a lot of exercise. Eat healthy diet. Reduce
Mm-hmm.
alcohol. Reduce smoking. If you not be able to reduce, stop them. If you dey do am, I don't know whether you dey do am, but if you dey do am, you stop it. Stop drinking. Stop alcohol. Eh? I don't talk exercise. Eat healthy food. Eat fruits. Fruit like cucumber, watermelon, tiger nut, banana. Eh? If you want, take yogurt, but the unsweet form of yogurt. Yeah? All these ones will help you naturally. Then visit your doctor. And the doctor when you need to visit is the urologist, and those when they specialize in that part, because they go also follow you up to find out what else can be causing it. If na hormonal cause, they go help you out for that, and every other thing can follow. But first of all, remove your mind.
Thank you for that comment. Very important. I also know that a lot of young men, I don't know how old you dey, a lot of young men they go through this challenge. If you don't try everything where Dr. Israel tell you, please discuss with your doctor. Discuss is important. We will not come here and tell you if this one they do you go to market and go and buy pepper soup. No, we are medical professionals and we will tell you to always see your doctor. So I beg, in addition to all this, if you know say you don't do them and it's still there, you need to speak with your doctor. You people know they share the live session. I don't know why. I they see their names, but if we ignore now, they go they vex for us. Okay. What is it possible for one fasting blood sugar to be 94, have insulin resistance? And how can one reverse insulin resistance? Please let me allow Dr. Israel respond to you. Your fasting blood sugar is 94. And who can't tell you so you get insulin
well,
resistance?
well the thing make me laugh. I don't know if you are diabetic, but if your fasting blood sugar is 94, you are doing well, because what is the normal fasting blood sugar is 60 to 110. So if you get 94, you are doing well. You are doing perfectly well. So I don't know where your insulin resistance is coming from. So when we talk about insulin resistance, it means say the body no dey fit collect the insulin again. Eh? E no dey fit collect the insulin. This time they need to dey give you insulin. And so because most of the time na the insulin when the body dey produce, na they no dey fit use. And so
Mm,
there are medications that can use. I don't think there's anything you can do to reverse it, but there are some medication you can take that can help you to be helping. Now those medications can they help you, they break those sugar within inside your body. So but it's not like saying in fact, if this person is diabetic, I can tell you that you are doing perfectly well. Having a fasting blood sugar of 94.
94, yeah. Yeah, you are. So I don't want to add to that because I did read some comments here and we are almost out of time. Now, let me say something for all the people where they watch, if you they watch this live session for the first time, listen carefully. This program has been on every Sunday for more than 5 years. Every Sunday by 8 p.m. We day here by the grace of God for 5 years. So not be today we start. Number two, we don't do so many videos. So in case you come, you say, please do video on this. We have done video on that. The only thing is now you know one get patience, find them. So go to YouTube, our YouTube, look for the video there. You go see them, watch. But we dey come like this to answer some questions so that we go fit guide you. No be say we dey here so that we'll come say, make you come meet us. No, to guide you, make you understand, and encourage you to see your doctor. And that is what we do here. Please, there is someone who lives around me. The person is 2 months pregnant. She keeps having abdominal ache, stomach pain, and she have had miscarriage 3 times before. And the miscarriage usually comes with this stomach problem. She have gone to the hospital, but the doctor said the pregnancy is too early and they can't do anything now. So what could be the cause of the pain? Ma allow Dr. Israel respond, abeg.
Okay. I will beg this your person when you say they live around you. He has had miscarriage 3 times. Now the same hospital now they manage am.
Mm,
Because if not the same hospital and he don't get 3 times and the same hospital they tell am this, e mean say no be hospital he dey go.
correct. Make go somewhere else. Quickly.
Two, is the person that is managing this person a gynecologist? For someone that have had miscarriage for 3 times should not see any other doctor if it's not a gynecologist.
Mm,
That have miscarriage 3 times should not see any doctor if it's not a gynecologist. So this one not be the one where you go private hospital. This one are the one where you go government. In fact, teaching hospital. I know
mm,
say some of us go say, if you are in Nigeria, you will understand. You will know that what I'm saying now. I know some of you will say a teaching hospital for the see us, but this kind of person should
mm,
be seen in a teaching hospital by a gynecologist. By a gynecologist, there are things to be done. If the doctor say there's not lie, there are things to be done. Well, let me not say na lie. It's not fully correct. There are things to be done for the woman. So the woman need the best thing I will tell you. You can say I'm very serious saying it. This one is not about what is causing the pain. I don't want to even know what is causing the pain. Eh? You being pregnant, yeah, you shouldn't be having pain, but there are some pains that comes with pregnancy, when the ligament is stretched and all that. Yeah. But for the reason why I'm so particular about it is because it's like a routine something. It go happen like this, it go have miscarriage, it go happen like and it don't happen like same way 3 times and it don't dey happen again. na im make the person must act quickly. See a gynecologist in a teaching in a government hospital, a teaching hospital to be precise, and I tell you, you will have the best.
Okay, thank you very much. We are almost out of time. Your comments, questions plenty for here, huh? So now you make nobody say we dey ignore anybody. Comments are so much. I gave birth through cesarean section and they gave me injection for my spinal cord. Sometimes I feel pain. What should I do?
Okay, for those that did see it and they gave you injection from the back, most of the time, yes, you go always feel those pain. You go feel the pain sometimes, but as time goes on, for most persons, that pain go wear off. For some persons, the pain won't go. Eh? So what you do is that try to reduce every work that will make you bend and sit in one place for a very long time, a really longer time, for a very long time. So that when you feel reduce stress to that area, that pain go reduce. And also you will also like it go also good if you see a physiotherapist. Physiotherapist go physically help you, give you some treatment for that place, and it could also go well. But the thirdly, see the hospital when they for do the surgery and make your complaint.
Okay, before I round up because of time, one more time again. If you are a content creator, whether you be papa, you be mama, you be elderly person, or you be young person, and they have told you to go and be posting on the internet anyhow, and you no learn anything, it change oh, it's not like that oh. Social media don't change oh. I beg you, may you no go suffer. Yes, I have a course that will help you. It's not compulsory, but it will help you. Those who don't get them, those who don't buy them, those who don't go through the course, they can testify. They understand now. So if you never do them, get my own course. It is cheap, $10, extremely cheap, or £10. You understand? So send an email now and get your own. Get your own. Oh. If they strike your page, I beg, no go help you. Oh. Please learn, learn. Mhm. Okay. Let's see, we are almost out of time. Let's see. My cholesterol is 230. Is it that dangerous?
Please see your doctor for that cholesterol. It will tell you what to do. But if you dey eat a lot of fatty diet, you need to reduce them. If you know they do exercise, it's high time you start to dey do exercise. I
Yeah,
hope your BP is not so high. So
yeah.
reduce your fatty diet, start
Mm,
exercise, you may just be fine.
yeah, you may
And
just
reduce
be fine. And
alcohol as well.
yeah. Also, people just believe that when they check one test, one result, that is the only thing. Don't know that your doctor will look at many other things. Look at within they influence the cholesterol, within the cholesterol feel also cause in the body, and which other medical condition feel you feel also get when you also get high cholesterol. So it's not just because you get high cholesterol, what should I do? There are other things your doctor will need to look at too. What is your BMI in addition to that? Do you have metabolic syndrome? Your lifestyle, your age, many things to consider. So please book a consultation with your doctor quickly. Make them check you. Huh? Um, you know, read my message. Is sugar level 138 diabetic? I need your answer. Diabetic, is it fasting? Is it random? You didn't tell us, so we can't tell you, and that is not how we comment. So is it fasting blood sugar? Is it a random blood sugar? You see, so we can't tell you. We can't even tell you. We can't diagnose diabetes on a live session like this. We just because we have seen your result, but there are things to look out for. So is it a fasting blood sugar? Is it a random blood sugar? Uh-huh. Okay. We are out of time. We don't. Dr. Israel, one more. Let's see. I did look for questions here. Oh, I did look for questions. Let me see if there's anyone where I jump. Oh, I did look for people. Please, doctor, solution to low libido. She know they get urge for sex.
Well, sometimes I don't really know what to say on this. Oh, Dr. Fred, if you like say you help me out.
Okay,
You
God.
dey laugh.
See, okay, no vex. Low libido, no urge for sex. Every human being at one point in time fit get low urge for sex. Maybe you are occupied, maybe your mind. But if you notice that this your low libido, this no urge for sex, e don come dey very prolonged. E dey affect, I don't know whether you're married, e dey affect maybe your marriage. You no fit meet your partner. Something needs to be done. Are you having hormonal issues? Are you having mental issues? Cause mental issue too wey we no dey look into. Fit a woman no go knack you if her mind is carried o. You understand? Mental issue. She having financial, there are other things bothering her. Is she having a medical condition? Is she having a problem with her partner? She and her partner. So it's a complicated thing. No be something wey we fit just tell you say if you get low libido, go and drink this medicine. No. Shey you understand? So for one woman, it might be finance. For that one, another woman, it might be that she's sick. For another woman, it might be that she's going through mental stress, anxiety, depression. So it's a very big area that you also need to see a doctor so that we fit know wetin dey go on with you. E fit be age related as well. So many things are involved in that. So again, see your doctor. I have to go because of my network. Ezra, any final words?
Okay. The final word to today is thank you so much, all of you. Thank you so much. You when they follow us, you when they listen to us, you when they watch our videos, and you when go still go back now, go search and hear wetin we don't talk. Some of these questions when you ask, we have actually made videos for them. So go and check. Go and just go and check.